and welcome to Chapter 18. In this chapter, we're going to talk about social insurance, which includes unemployment insurance, Social Security, disability, among others. So let's start with what is a social insurance program? Well, these are programs run by the government to help provide a safety net, security net for its citizens. Some countries have very evolved, very detailed social insurance programs, and some countries have less. So the United States falls somewhere in the middle, where we have a number of helpful social insurance programs, but we don't have social insurance programs that would cover the entire population for things like retirement, healthcare, college expenses. But we do have several programs that are rather useful. And these programs are put in place to help solve some of society problems. So many of these programs came into place after the Great Depression, and people thought it was a real bummer to see their grandparents living on the street and seeing so many old people destitute and penniless that they decided to create Social Security to help provide some income for some more elderly people and some other disabled people, things of that nature. Now, it's something that helps society become more civilized and helps to transfer funds through taxes from the wealthier individuals to the poorer individuals, and provide some economic security to people at the bottom of the income scale. Now, there are certain characteristics that distinguish social insurance programs from other government insurance programs. So these programs, have to be compulsory, meaning that with few exceptions, the program is going to be something everybody's going to be involved with. The advantages of a compulsory program is going to be provide a floor of income for a population, such as the elderly, provide coverage for both healthy and unhealthy individuals to have a better life, a program that is compulsory is going to cover everyone as a contingency reserve for income, among other types of support. So these programs are going to cover everybody. Everybody's going to be involved in them. You can't opt out of them. In the case of Social Security, that's providing a base income for depending on if you meet the criteria to receive Social Security, which in most cases is just age related, and try to create some social equality with a transfer of money from much wealthier individuals to lower income individuals. Not necessarily a program where the money you put in is the money you're going to get out. Like your 401k, 403b that we talked about last chapter would be a program where the money you put in is going to be related directly to the money you have taken out. In Social Security, some people may put in more money than they receive. Certainly, if you die early, you may not receive the full amount of money that you put into the program, and or some people though may have lived past 100 and collected much more from Social Security than they ever put into it. So that's what they mean about social. What I would say a social, more of a social equality and not individual equity. But benefits, as far as Social Security, they do have a relationship to earnings. So the more you earn, the more you pay into Social Security, the more you will receive. But for some people, they'll pay much more into Social Security than they'll ever receive. And we'll talk more about that later. There is a means test that is not required for these social programs, and the full funding of these benefits are unnecessary as well. Meaning that for certain pension plans, there's much more strict requirements of the level of funding to support these plans. since most of these government plans are funded by taxes and a growing population base, they don't need to fund, there's no requirement to fully fund the benefit currently. So let's move over to what most people know as Social Security. This is also known as Old Age, Survivors, and Disability Insurance, with the acronym being OASDI. And it's probably the biggest, most important social program established by the United States. And this was a direct relationship to the Great Depression that started in the 30s. So the Great Depression was, we came out of a time in the 1920s, 100 years ago, where stocks were booming, people were making money left and right. It was just a decade of prosperity. But when the stock market crashed, and people's margins accounts were crushed and their stock accounts erased, it developed a lot of poverty. And as the jobs were, more and more people became unemployed, and that was a time before unemployment insurance, before Social Security, before any of these social net programs. It was just devastating to the country. So as a result of the instability of the Great Depression, Social Security was developed. So virtually all employees are going to be covered and involved in with Social Security, because it's a tax that we all pay every paycheck, whether you're self-employed or working for somebody. It's something we're all contributing to. Now, to become fully insured by Social Security, you must have what they call 40 credits. So you earn the credits by working over a certain period of time. So because they don't want someone to walk into Social Security with only working 2 years, so you can't start work at 62 and then retire at 65. So they want you to earn an amount of credits as you progress. And this amount of credits has changed over time. And these credits are going to, how they work it is you earn credits for every quarter that you worked. So I'm trying to see the amount of years that would equal. I believe that's 10 years of work to be covered by Social Security. So now, if you're currently insured, there's also eligibility for survivors. And so there are other programs within Social Security. It's not just for retirement. So it depends on, as far as disability is a big part of Social Security, and that's going to depend on, since people can get disabled at a younger age, you don't need a full 40 credits to get disability. They're going to prorate it with your age and the disability. So just some things to think about. So as a minimum, you want to earn those 40 credits so you can participate in the benefits. Now, most people will have the 10 years, no problem. And we'll talk more about how the income you pay into Social Security results into the payout. Now, for most retired people in America, Social Security is the majority of the funds that they retire on. So a huge number of Americans don't save properly for their retirement, and their retirement is drastically underfunded, or not funded at all. And Social Security is the one thing that they can rely on upon retirement. So and it depends when you're born. If you were born before 1937, you get your full unreduced benefits at age 65. People born in the 60s or later, the retirement age is going to be 67. So, but you can retire early at 62, but you get a prorated amount of Social Security for retiring early like that. Now, for monthly retirement benefits, these can be paid to, of course, the retired worker, the spouse of the retired worker. So, because America was based on a one-income family for so long, where one of the two married people was working, the other person stayed home and took care of the house or the kids. You had a situation where they wanted the spouse who didn't work to be protected as well. So if you were married and one of the married people attained the retirement benefits, the spouse would have retirement benefits as well, usually at 50% of the husband's, depending on whether the husband is alive or dead, or in situations like that. And if the wife did work, if her Social Security is lower than what her spousal benefits are, she could revert to her spousal benefits. Unmarried children younger than 18 can receive Social Security. So, for example, if their father is disabled or their mother is disabled and they're a single family household, then children do get some support on disability. Unmarried disabled children can get Social Security, and a spouse with dependent children under age 16 gets money in that situation as well. So there are different types of ways Social Security can be rolled out to people besides the main person working. Okay, so let's look at the ages to receive the full Social Security. So the full retirement. Now, so if you're born between 1943 and 1954, you can retire at age 66. And as you get born later and later, finally people born after 1967 will be able to retire people born after 1960 will be able to retire at 67. So why is this scale of full retirement age set up like this? Well, in the 80s, we had a crisis with Social Security running out of money. So they revamped Social Security, changed the law, and made it solvent. And one of the things they did was increase the retirement age. And it makes sense because when Social Security was first started, reaching the age of 65 was not as common for most people as it is today. And the life expectancy has increased a great deal since Social Security was first enacted. So most likely what will happen soon in our society within the next 10 to 20 years is they'll have to move the retirement age up again. So they may eventually in your lifetime, you'll probably see Social Security retirement age move up to 75 years to take into account the longer lifespans. They will also most likely increase the Social Security tax, which is called FICA, I believe, on your payroll. And this will have to be increased to keep the plan solvent because the demographics of America are ones where the population is getting older, not younger. So there's going to be fewer workers to support the people on Social Security. Unless something drastically changes with the demographics of the country, maybe 100 million new young people come to the country or are born in the country, then that could help balance out the unbalanced current Social Security that's set up. So this is why right now we have this scaled full retirement age. Now, there's also early retirement too. So if you want to retire at age 62, you can retire at age 62, but with reduced benefits. So they're going to prorate your benefits lower if you want to retire earlier. We'll talk more about that later. Okay, so let's talk about types of benefits. So there's the monthly retirement benefit based on the worker's primary insurance amount, or what we call a PIA. And this is going to be indexed to average monthly earnings, or so this is basically a weighted average formula that's going to look at how much you've earned over your lifetime, and it's going to take the 40 largest working years, and it'll come up with a formula to figure out how much Social Security benefits you're going to receive. Now, people who pay the most into Social Security are going to receive proportionally a smaller amount than people who pay less into Social Security. So even though the people who pay more will get the bigger check, People who make significantly less don't get significantly smaller checks. Their checks are smaller, but the benefits weighted in favor of the lower income groups, and that's part of the inequality of the system. But that inequality is on purpose because the social benefits of giving everybody a living wage is one of the goals of the program. So Social Security has a bunch of actuaries who are going to calculate and index factors that are going to use to determine a worker's index monthly earnings. So it's a complicated formula, nothing that you have to calculate or we're going to go over in this class, but here's an example of retirement benefits and replacement rates at the normal age of 66. So these are your earnings. This is in 2019. This was the maximum taxable earnings. It has gone up since then and goes up every year. So basically, what's great about this is if you make a lot of money, say in 2019 you made $150,000. After you reach $120,000 income, they stop taking Social Security tax out of your check, which is like getting a 6.5% raise at that time. And the reason for it is that in the current laws, since your benefit stops being calculated at the maximum earnings rate, why should you pay tax above that? Because you'll never get that money back. I have a feeling, though, in order to balance Social Security in the future, like they do with Medicaid, they're going to tax all of your income and not have a maximum taxable earnings cap. And that would be probably would be something that most people will be okay with, because most people don't make over 120, or now it's like 130 something $1,000. So most people would be sure, why not, if it makes Social Security more stable. But the people losing out are the people at the higher salaries, which only matters to you if you're someone at the higher salary. And if you're taking this course, you definitely will be at the higher salary at some point in your lifetime. It's one of the advantages of taking this course. There's no direct correlation to how that works. It's just magic. Okay, I'm kidding, of course. So let's look at this chart some more. So here's the payable benefit, $9,000. So that's 73% of your income you get paid out as a percentage of your average earnings being replaced. So by the time you get to the maximum scale, you're only going to get about 26% of your earnings replaced compared to what you make. Here's your earnings, but your payable benefit's only $31,000. So you're making 3 times the low end of the scale, but you're only getting 26%. So 31,000 is 26% of 120,000 back in Social Security payments. So there's an example of how it's going to be distributed in an unequitable way, because we want to create a living wage for the very low earning people. And that's a good thing, because you don't want a bunch of older people who've worked hard, even though they weren't paid a huge amount, to have insufficient funds to retire on or have a life upon retirement. And they'll just, you want everybody in who's retired at an older age to be able to have a be respected in the way that they can still fund their life. Okay, so continuing with types of benefits. Each additional year of work adds another year of earnings to your Social Security record. So if you work longer, you can increase the amount of Social Security that you're going to get paid. So if you delay your retirement, you're going to get extra credits that are going to go beyond the retirement age. So if you work to say age 70 or 75, you're going to be receiving benefits beyond the full retirement age. So they're going to be adjusted for the fact that you're delaying your benefits. And you can increase, if you had a monthly benefit of say $1,300, by the time you're 70, if you haven't put in to receive your Social Security, that can go up to about almost $1,700. There's also a COLA, which is a cost of living adjustment. So this is basically to fight inflation. So your benefits will go up based on the rate of inflation. Okay. Then there are earnings tests as far as when you receive Social Security, you may lose some monthly benefits if you earn too much outside by working at the same time you're receiving benefits. So even though you're retired, you can also continue to work and make some money, but that's going to affect the amount of money that you're going to receive based on this additional work. Now, there's also what we call survivor benefits. So survivor benefits are, unfortunately, if somebody does die, the people who are left alive, say a person in the family dies, you could have dependents of the deceased worker who are going to be, compensated or insured based on the survivor benefits. So the groups that are included are, unmarried children under 18, unmarried disabled children, surviving spouses with children under 16, spouses of the age 60 or older, disabled widows or widowers between 50 and 59, dependent parents. So the Social Security is going to provide a substantial amount of financial protection for these families in case the breadwinner in the family, as they call them, dies. So it's a good type of program because if there was one breadwinner in the family and they die, the family would be destitute, financially destroyed, and have no means to support themselves initially. This would be a life-saving amount of income to keep the family going after the main breadwinner has passed away. So this is a very important benefit. Again, this prevents a lot of homelessness, prevents a lot of poverty. So that's an important point. Now, to step back a second, I want to talk about we talked before about early retirement. I just want to talk about a couple things related to early retirement. So the question is, should you, retire at your normal retirement age, or should you retire early? So if you retire early, your benefits are going to be less. Now, there could be some reasons to retire early. For example, if you do if you're forced to retire early, say you lose your job at age 60, and that means you'd have to wait to 65 for full retirement, or 67. That's going to add a lot and you can't find work of any kind. That's going to add a lot of 0 years into your average 40 years of working, which is going to lower your overall benefit. So it may be advisable to take your benefit at 62, knowing the fact that you're probably not going to work from 62 to 67. Also, if you're in very frail or bad health and you're not likely to live another 10 years or even 15 years, it probably would make sense to take a early benefit. But postponing your benefits to age 70, if you're very healthy, you enjoy work, you have enough money, and postponing your benefits is a great way of guaranteeing a much larger Social Security check when you do retire at age 70. And this could be important because Social Security, unlike your 401k or your 403b, which most people will have for retirement, that's not infinite. It's finite. But Social Security will be there for your whole life. So even though you may run out of retirement funds, if you live to 100, then Social Security would be there for you. So if you can get the maximum amount, that would be a real good way of guaranteeing your income for life to live off of. Now, let's switch over to disability benefits. So what is disability? Well, unfortunately, some people get into a situation where they're unable to work. And if you're unable to work and gainfully, in a gainful manner, you could qualify for a disability. This could be people who could be both physical or mental, but you're just, if you meet the requirements, then you can go into this benefit, which is going to protect against the loss of income. So this is a long-term type of disability that the government will pay to people who are not able to work in any gainful activity related to their education or work history. And this is also, for families where, maybe the breadwinner in the family has a head injury and can no longer, work a job due to a mental condition. This will provide income for that person as well as the family. So it's a very important benefit to keep American families the ability to survive in some of the worst times. Now, the major groups able to receive this disability income benefit, disabled workers under full retirement age. Once you hit retirement age, there is no disability available to you because disability is meant to replace active work income under the retirement age. So once you hit the retirement age, you only get Social Security. You don't get both disability and Social Security. The spouse of a disabled worker, unmarried children, if under the age of 18, unmarried children age 18 or older who become severely disabled themselves before age 22. So these are all other people who will receive benefits under this grouping as well. Now, if you receive monthly cash benefits, you must pay income tax on part of the benefits. So the amount is going to be dependent on your combined income. So if you look at what they list the acronym OASDI, I'm just going to call it Social Security. If you look at Social Security and Medicare benefits, they're financed by payroll taxes that employers and employees pay, and also the self-employed. So how it works to say for Social Security, the tax is 6.2% on earnings up to $128,000, but that increases. It's already much higher than that right now. It's going to be every year it goes up by thousands of dollars. So, but that's when it gets to the maximum, you don't pay any more Social Security. Now, you're paying 6% for Social Security, and your employer is matching that. So you and your employer together are providing over 12% of your income to Social Security for your whole life. Now, Medicaid is going to be around, anywhere from 1.5% to 2%, depending on what year it is. And this is based on your entire income. All the income you earn will be taxed from Medicare. Now, so that's how these programs are funded. And if these programs become underfunded, then the government is going to have to raise taxes or reduce benefits. But we'll see how that works out at a later date. Anyway, your combined income is going to put you in a possibility of being taxed. So Social Security is not 100% tax-free. There are situations where you could be paying tax on your Social Security. And the taxation rates change depending on how, the year it is. They are adjusted quite often. And, in some cases, you may have to pay tax on 50% of your benefits or 85% of your benefits, or all your benefits may be tax-free depending on your income level. So that's important to remember and think about. Now, let's switch over to Medicare. So what we discussed in other chapters is retirement. And one of the big costs of retirement is health insurance. So one of the reasons most people won't be able to retire before the age 65 is that you won't be able to afford your own healthcare insurance. So say, for example, you're working with a job right now and they provide healthcare insurance for you. You're only most likely paying a fraction of what the cost of the plan is. So it could cost you $20,000 a year to have healthcare insurance before age 65. That's a significant amount of money, which forces most people not to be able to retire early unless you have a job that will provide you health insurance before age 65. Not all jobs will do that. So anyway, if you are 65 or over, the government will step in with a Medicare plan. And the Medicare plan is going to be a healthcare plan for majority of people over age 65. And it doesn't matter what year you're born in, everybody can attain Medicare at 65. And these benefits include a Part A and a Part B, and they include drug plans and healthcare plans from private insurers. So it's a pretty complex system. So under the original Medicare plan, Medicaid is a different type of health insurance for low-income individuals, which is not covered in this chapter. We're just talking about Medicare. So sometimes they mix them up. I'll try to be very careful not to do that. Benefits can, it can differ depending on how you structure your Medicaid. So, because there are, the original plan, Medicare Advantage plans, Medicare health plans, and prescription drugs that we were talking about before. And you can elect any provider that's going to accept the Medicare patients. So many doctors and hospitals will accept Medicare patients, even though that may result in lower income or lower amount of reimbursement for them. It does hold a significant pool of potential patients. So the Medicare will pay a share of the bill, and the beneficiary would generally pay the balance. So Medicare is not a system that's going to pay for everything 100%. You are going to have to contribute money into the plan, just as a annual amount of money. You will have to pay money to maintain your Medicare plan. And the government generally will take this out of your Social Security check. And you also have to pay for, they will not always cover 100% of everything. You'll have to pay for the balances of that. Okay. So let's talk Medicare Part A. So Part A is going to be the hospital insurance. So this is going to provide coverage for inpatient hospital stays and other services. And it covers up to 90 days for each benefit period. Inpatient care to a skilled nursing facility up to 100 days. Some healthcare services in the patient's home can be covered. Hospice care could be covered. That's for people who have less than 6 months to live. Blood transfusions will be covered. So there's a number of things covered under Part A. So hospital reimbursement for inpatient services, as well as but Medicare does work with the hospitals to try to encourage them to be more efficient and more cost conscious. So, the benefits of Part A are really going to be your hospital and home care related benefits. And, this DRG, which is the diagnostic related groups, that's how the hospital is going to reimburse for the in-person services. It's a payment system, and it's going to be a flat amount paid for each type of care, depending on what the diagnosis group is in which the case is placed. So it's a flat, uniform amount paid to each hospital for the same type of care or treatment, is how they define it. And switching over to Medicare Part B, this is the medical insurance that's going to cover your general doctor, your outpatient care, your home health services, medical equipment, other medical services. So this is pretty much everything outside the hospital. So you pay a monthly premium for these benefits, and they must meet an annual deductible. So, and the program is going to cover 80% of the Medicare approved amounts for most services listed. Now, some of the services that are excluded that are not going to be paid, Part B or Part A are not going to pay. Let me just see. So let me go down here for a second. Okay, just want to make sure that. Okay. Such as dental care, eye examinations, prescription glasses, dentures, cosmetic surgery, acupuncture, hearing aids, long-term care. These are things that are not going to be in Part A or Part B. Now, So the Part A is financed by a payroll tax, which by covered employees, employers, self-employed. So this payroll tax is this does change. At the time of the publishing of this book is 1.45%, and that covers all earnings you make. There's no cap on this like there is for Social Security. And other general revenues that help to fund the program. And Part B is financed by monthly premiums that people are going to pay directly to Medicare, and also some revenue from the federal government. So that's important to know that with Part B, there's going to be some funds authorized by Congress that to help pay for Part B, but the majority of the money is going to come from people enrolled in Part B, and also the Medicare prescription drug, which is Part D. So that's how it gets, Medicare gets very confusing that way. So if we look at Part C, these are private health plans that are part of the total Medicare program. So what we have here is similar to what insurance you may get at work. So these are going to be private health care types of plans. They're going to be connected to Medicare through Part C. It's going to be a separate monthly amount that's going to be paid for this plan. And it's going to provide extra benefits that have lower co-payments than the original Medicare plan. So it's sort of an add-on. It's sort of an a la carte feature. And most of these plans are going to have prescription drug coverage as well. So now, if you get that, some of the health organizations that we talked about in previous chapters, we have the Health Maintenance Organization, the HMO, which we have discussed in previous channel, which is a managed care plan that's going to be managed by a private insurer that will, as we talked about in previous chapters, you have to choose a primary care physician and have referrals for specialists. And the plan usually covers prescription drugs. There are co-payments and co-insurance charges for this plan, but it's going to be organized and offered through Medicare, and you don't have to take it if you don't want it because it's going to cost extra. You also have the option of a PPO, which you can, we talked about this also in a previous chapter, where you can see any doctor that's going to provide, that's going to accept Medicare patients, and it's going to be another organized health plan. So you can see how Medicare gets confusing because there's a lot of options. And when you go to choose an HMO or a PPP, there may be only a few in your area or many in your area, all offering a different packages, a different co-insurances, different co-payments, different doctor groups. So it becomes, a huge endeavor to really decide upon and carefully pick how your Medicare plan should be organized. Now, there's also, you can get the private fee-for-service plan under Medicare, and this is going to be, again, a private company. So rather than Medicare, they're going to decide how much it will pay for amounts that members, you must pay the difference for the services provided. There's also a Medicare special needs plan to provide more focus on, specific groups of people, chronic illnesses and whatnot. And there's also the medical savings account plan where Medicare will deposit a certain amount of money, and then you could use this to pay for your healthcare costs. So like in private insurance, all these options are also involved in private insurance. So in private insurance, you have your HMO, your PPP, your private fee for service, your special needs, and your medical savings accounts. These are just a choice you have under Medicare if you want to pay for and get this extra service or extra coverage. Now, so Medicare beneficiaries have other choices of coverage besides those what we call the Advantage plans. So these plans are part of the overall Medicare program, and some of the plans provide, so these Advantage plans can provide both Part A and Part B, and most may only provide Part B. So these Advantage plans, you have to look into very, very closely to see what the cost of these plans are going to be and how these programs are going to benefit your particular medical needs. Okay. Now let's talk talk about Part D. So this is the prescription drug coverage. So, Part D is just another program that all Medicare people who have Medicare can choose. And, but to obtain this coverage, you have to belong to a private plan run by an insurance company or a private company approved by Medicare to be inside of Part D, which is going to be an extra cost, and you have to work through another insurance company. And there's a lot of plans available for this Part D, and they vary in cost and types of drugs that are going to be covered. So that's why you need to know your plan pretty closely to get the plan that matches most closely to the drugs that you need, so that you get the majority of them at a low cost. So the beneficiaries have to select the specific drug plan, pay monthly premiums for this drug plan. The premiums and deductibles are waived for beneficiaries with limited incomes, and they have things like Epic and Extra Help that help lower the costs of these drugs. So beneficiaries covered under the original Medicare plan can add a prescription drug coverage to their benefits by joining a standalone Medicare prescription drug plan that's going to cover only prescription drugs. In addition, beneficiaries can join a Medicare Advantage plan or other Medicare health plans that also provide prescription drug coverage. So in addition to being covered the Medicare services, you also get the drugs. So now you're going to be covered for prescription drugs as part of your group plan. So you can see how this is all very intricate, and it takes a lot of research. And you can see how an older person who maybe has some cognitive issues could really struggle with picking their Medicare plan. They do have advocates that can help elderly people, that could represent them and help explain things to them and help go over their needs. So there are advocates that can help demystify this maze of Medicare. Now, let's just talk about, the cost of prescription drug coverage. So most plans are going to have a monthly premium that you're going to pay in addition to the Part B premium you're already paying. But some beneficiaries who have a high income must pay an additional amount for that Part D coverage. So if your income is going to be, say, over, generally, somewhere between 85 and 175,000, depending if you're single or married. These numbers change every year as laws change, but there's going to be extra. You have to pay extra to get this prescription drug service, depends on your income if you make more than the average person. So there's a lot of fine print when it comes to the annual deductible, the co-payment or co-insurance charges for prescription drugs, the coverage gap. So most Medicaid drug plans have a coverage gap, also called a donut hole. And this means that after you and your plan spend a certain amount of money for covering drugs, you must pay all the drug costs out of pocket until you reach a maximum limit. And that, and then after you reach the maximum limit, the amount you pay will in the coverage gap will be covered towards the out-of-pocket limit. So there are minimums and maximums that you can hit. That there's over a certain point, they're going to cover everything. So if at a point where your spending is over, say, a $5,000 amount, you can hit this catastrophe coverage, and then you're only going to pay a small amount of insurance or co-payment for drugs after that amount being spent. And like I said, for people with lower incomes, there are plans to help reduce the amount that you would pay for this coverage. So it's important things to know. Okay. So you can purchase something called a Medicare Gap Insurance. So because of all these exclusions, deductibilities, and cost-sharing provisions and limits on Medicare, since they don't pay all your medical expenses, you can buy this gap insurance, which is going to help cover charges not paid by Medicare. So the Medigap is going to be sold from, again, a private insurer who's going to help fill the holes in the Medicare program, so there's less of a chance you're going to come across any health costs that may not be covered. Okay, some problems and issues with Social Security and Medicare. One which I talked about a little bit before is going to be, the financial problems. That the trust fund is going to be exhausted relatively soon, and there's not enough money being pulled in to pay for a majority of benefits. So this is a problem. The disability trust fund is going to be exhausted within this decade as well, and the tax income is only going to cover less than 100% of the scheduled benefits. So this is a major problem of underfunding, and this is related to the a certain number of factors. Now, such as older populations, more people becoming disabled, more disability fraud. All these things are causing the plans to eclipse the amount of funding that they have. Now, this deficit can be reduced by increasing payroll taxes, but nobody likes to have their pay taxed even more. So that's unpopular with citizens and voters, but that's one way to fix it. Decreasing benefits, also very unpopular with citizens. Using general revenues to pay for benefits from the government. But basically when you use general revenues, they're going to have to come from another source or another tax source, or a combination of these. Some changes, progressive indexing to determine benefits, increasing the Social Security payroll tax for both employers and employees, moving up the schedule to increase full retirement age, something I talked about earlier. And I would guess that in your lifetime, you're going to see this moved up to age 75, and reducing the benefits for future retirees, which I think would be probably the worst thing to do, is reduce the future benefits, because it'd be better to increase taxes on Social Security or increase the retirement age rather than penalize the people who are currently unable to work or gain any additional income by reducing their future benefits. But all these things are on the table. If once the fund runs out of money, the government is going to scramble to try and fix this. And these are some of the things that they can do. And they've done before when, say in the 80s, I said when there was a similar problem with the fund for Social Security. They can also increase the taxable wage earnings base for Social Security. Many people are in favor of that because it doesn't affect most people. Probably only affects 20% of the population who earn over $130,000 a year. But it is it makes the program even more unequitable. So if, perhaps you make $1 million a year and you're going to be paying 6% of your salary into Social Security, or more, 6% or more of your salary into Social Security each year, plus your employer's contribution, you're only going to get a fraction of that back. Meaning they're going to make the wealthy pay for Social Security, which is most likely what they will do, because that's probably, as a politician, going to be the least amount of pushback you'll get from the common voter. Subject all benefits to federal tax income, meaning that your Social Security will be taxed at 100%. There'll be that will be basically reducing everyone's Social Security if they have to pay tax on it. So it's a sneaky way of giving you your same Social Security, but then taking it back as it's being taxed. Extending coverage on a compulsory basis to all state and local government employees. Some government and state employees aren't in the program, but if you extend the coverage to them, there'll be more money coming into the program. Increasing the number of years used to calculate retirement benefits from 35 to 38. So I guess right now they take your 35 largest wage earning years to calculate your retirement benefit. If they increase that to 38, that will theoretically lower the amount of benefits you'd receive, because that would include 3 more years of either 0 or lower earning years. Or invest some of the trust fund. The trust fund is the money that's already been built up, and inside Social Security, invest some of that money into more lucrative private investment stocks and bonds, which have a higher yield than the current treasury. So another problem with Social Security today is that it's invested in U.S. government bonds and treasuries, which are earning a very low return of around 1%. And this is one of the problems that they have a hard time keeping up with the fund. If these were invested in stocks and bonds, these funds would be having a much higher return. But it's a sticky thing to do because you want the government in bed with investing in companies, and it gives the government a little bit more control over companies and can lead to manipulation of stock prices, as well as greatly inflating a stock bubble. And also leads to the potential problem of a stock market crash, wiping out a significant amount of the trust fund. So it's more instability in that portion. Okay, other problems. If we look at the shortfall of the disability income trust, the separate trust, now this is because the amount of people in the labor force as the population has increased over time. So as the labor force has gotten bigger, then more people can apply for disability because there are more people in the labor force. The aging of the population and the baby boomers, the largest generational slice we have are these baby boomers, and as they get older, they're more likely to be disabled. So the older you are, the higher chances are that you'll be disabled. And that's going to put more strain as this bigger segment of the population becomes eligible for disability. Increased amount of women in the labor force. So what this basically means is not that women are disabled more. It's just the fact that for a long period of time in the earlier part of the last century, less women were in the workforce, and as time moved on, especially through the 1980s, more women had entered the workforce, so now they become eligible for disability as well. And women have caught up with men as far as the rates of becoming disabled, because traditionally women were disabled at a lower rate than men, or a lower percentage than men, and now that is increasing. The higher full retirement age, people have to wait to 67 to retire. If they move that to 75, then more people will likely fall into the disability age. So if you gave everybody full Social Security at age 60, there would be less people applying for disability because they are on Social Security. You can't collect both. So as they extend the retirement age, there's going to be an effect, an increase in disability. Now, as we've seen in the downtrend business cycle of 2007 to 2009, that was a factor of increased disability, and also in the current down cycle of 2019 to 2021, with the medical situation going on, a lot of people are going to be disabled from this medical crisis as well. And generally when there is high unemployment, it does encourage people to apply for disability insurance as a way of replacing lost income. So there are some people who may qualify for disability insurance, but are still able to work to the point where they're not claiming it. So if they do become laid off and can't gain any employment, they can seek disability insurance. And that does happen whenever a recession occurs, disability applications increase. Okay, as far as Medicare Part A problems, that has a lot of financial problems. Looks to be exhausted in the next 10 years or so. Dedicated revenue will only be sufficient to pay 88% of the hospital insurance costs. So, and this is going to be, one of the problems here with Part A is, of course, the ballooning or, increasing medical costs for medical services, the complexity of new medical services. There is a lot of new surgeries and drugs and therapies that will extend people's lives, but these come at a much higher costs than in the past when none of these therapies were available. And the extreme inflation in these therapeutic and drug therapies, costs going up by hundreds of percents. The aging population, the increased enrollments in the Medicare as more people become age 65 and more people live longer. This has all put a huge strain on the financial stability of Medicare Part A. Now, they've been working to try to hold down costs, you know, setting up payment schedules that reduce payments to hospitals and physicians. But this comes at a cost too. If you're going to pay the hospitals and physicians less for services for Medicare patients, more hospitals and physicians are going to decline to accept Medicare. So it's going to limit the choices or force the hospitals to become so efficient, patients are going to get lower quality of care. They could limit the spending on specific services, putting maximum spending on specific services. They can implement more of a DRG method for reimbursing hospitals, and other efforts to reduce costs are embedded in the Affordable Care Act that we talked about in a previous chapter. One big issue that they would like Medicare to have would be, and also which we're not covering here in Medicaid, would be for the government to be able to use these programs to negotiate drug prices with larger drug manufacturers, like other countries do. So right now, that is not a factor in the costs, which it should be. The government should be able to, get discounts on bulk for drugs. Now, we're going to stop here. In the next lecture, we'll talk about unemployment insurance, and I'll see you in part 2.